South African Union of Students has lashed out at universities that are planning to implement mandatory vaccination against COVID-19. Its Deputy Secretary General, Siyabonga Nkambako, has threatened to fight at all costs against forced vaccination. Well, let's discuss this further. We're joined now by the Higher Health CEO, Professor Ramneek Ahluwalia. Professor Ramneek, good evening to you, and thank you so much for your time tonight. It seems that it's becoming more and more unavoidable that this issue is going to result in some kind of conflict, because the conversation from a public perspective has been standing in the same place. So the students have been opposing. The universities have also, held fast to their position in terms of implementing these vaccinations. What are you expecting as more and more institutions of higher learning begin to reopen their doors?
Good evening, Kathy, and thank you very much for having me. Kathy, we find ourselves in very interesting times 2 years down the line from COVID, and we're learning a lot now from this virus. And what we've really seen is from the fourth wave, which we're still trying to come out, is that as much as this virus mutated and had shown many escape mutations, but it had lost its pathogenicity, that the severity of the infections was clearly seen moving down. And what we also saw, that somewhere down the line, the vaccine immunity holds its ground against the mutating virus of COVID in terms of severity of the infection. And I know there's a bigger debate that's going around with the fact that what does the future lies? Will the virus continue in its trajectory in a similar pattern of losing its pathogenicity or severity, and our vaccine or natural immunity will continue holding its ground against this mutating virus? Or the other school will always be the question that it's a mutating virus, which means the virus will continue to mutate, and possibly as much as it has taken an Omicron route, but there were deltas and betas, and those offsprings are still mutating. And will there be a possibility that the virus can still go back to its high pathogenicity route? Which means we need, as higher education as a country, to be prepared on both scenarios. Coming back to higher education, which is where the current debate is quite enormous, one is that we have the first year students now joining our institutions of higher learning, which is the time, this is a sensitive time for us because we're taking students into our system. And we have about over 700,000 new students that enter our system, and I talk about the entire post-school. And I'm talking about not only just universities, and I'm going to keep in grounds around the technical colleges, the vocational colleges, because the situation moves around in the post-school, entire post-school education. So the question will be is, when we're talking about mandatory policy or with policy, we need to be making inclusive of everyone and not leaving anyone around. And when I speak about is the fact that we're looking at a very phased entry of putting regulated approach, and that's why it's taking time on a sectoral issue of building a policy or generating a discussion around the policy around mandatory vaccination. So the question will always be is, how do we ensure from the signs that we have seen that vaccinated people have shown absolute low severity to hospitalization and ICU, which gives us a hope to now open our economic system, open our education system, which means laboratories, classroom activities, and issues that are related to residences. We can start bringing our students in, knowing that the vaccinated people have highest probabilities of not being in the hospitalization or ICU or deaths. And with that proposition in place, what we are now have to also balance is the first year students coming in, the new students coming in, and giving them the complete option of options of getting vaccination and promoting vaccination or vaccine education. So I think what we are working is considering around the fact that the last 2 years, we had to move 70% of our system online and 30% of our system in contact learning, which is not what the parents want. This is not what the next graduates want. This is not what the total student community will want. And this is not good for our economic skills building system, because practical courses, whether it's medicine like myself, engineering, whether it's laboratory works, whether it's plumbing, mining in technical colleges, it needs quite a practical on-site learning mechanisms, which means we need to now shift to a 70% at least a contact learning versus a 30% online, and vaccination gives us a hope. So at this moment, without not inducing policy into a system, the aim is very much focused towards getting more and more people vaccinated. All the South students, which is South African Union of Students, will agree and has agreed with us that the fact that we have to continue with the movement, they believe in vaccination. Everybody says that we have to promote vaccination and bring vaccinated South Africans more into the system of contact learning to minimize the risk of severity and hospitalization. And I think with that science, we are going to look at exemptions. We are going to look at the first years who are coming in full exposure to vaccine education. But we need to still be very cautious around how do we bring students into an in-contact, congregate setting, which is very close in classrooms, in laboratories, in our residences. And the phased approach is to start bringing vaccinated people in gradually, testing the ideas of how the outbreaks will, because we see major outbreaks among young people.
Sure. Professor Ahluwalia, going forward, because it now seems that we could well end up in some form of protest if the universities that are implementing vaccine mandates continue to do so. How are you managing the various interests of these stakeholders to ensure that learning is not going to be disrupted or affected?
So the few universities that have moved into the mandatory vaccination have also taken stands towards consultations, and that's what our appeal is. Because our appeal is, let's carry everyone together. A policy should never be a forced entity into the system. A policy is a consultative way of bringing everyone together so that we keep every parameter open towards not leaving anyone behind. And I think that's what is happening, and that's what we're doing, and what we're trying to appeal or work with is ensuring that should the institution has looked at its economic dividend, its workloads, its epidemiology, its access to vaccination, and is moving, it's still looking at every parameter of every student, which is the first years coming in, how does the exempted students come in, how does the weekly COVID test happen for those who are not vaccinated, how does the process happen of those students who will not be able to enter the residences because they're not vaccinated, to give alternative accommodations for those, and finding mechanisms. And these are parameters to work in every detail and carry a population together in order to mitigate what you say is a backlash. And I'm still confident, where I said, that having a proper dialogue and with all the SRC presidents who believe that vaccine promotion, vaccine education, and giving more access to vaccine on the sites will build a system where we will get more and more students vaccinated. Already, we are seeing about 55% of our student community either fully vaccinated or entered into our vaccination program through our on-ground survey results, which is better than youth results. So we're hopeful in that regard.
Professor Ramneek Ahluwalia, let's leave it there for today. He's the CEO of Higher Health.